Hi there, my YouTube family. Welcome to Rachel the Nurse. Got me a little session here to talk to you guys, and I am presenting to you guys repositioning. Okay, so I guess I'll just kind of show you guys the pictures and then I read it to you guys. Let's see that. So, this is the repositionings that you can use for, for no skin breakdown. So this is a very good way when when you have a patient that is bedridden. This is a good way of they won't have skin breakdown. So repositioning. So the first repositioning is lateral position, which is, let me fold it. Let's see if y'all can see that. Which is this position. This is lateral position. See if y'all can see the name too. That's lateral position. So what it is, it have like the pillow under the head, a pillow like between the legs, and then a pillow on, like the other arm can lay on top of a pillow. So that is lateral position. And it's very good to use these positions for your joints, your bones. It's kind of like stretching when you go to sleep. So it's always good to use repositionings for your patients or your clients, so that way they won't have skin breakdown. So that is lateral position. See, the pillow under the head, between the legs, and on one arm. And then when you turn them the other way, it's like always reposition every 2 hours if you have a bedridden patient. So repositioning is every 2 hours. And if they're on a tray, it's every 2 hours. Okay, and the next, I got it on this little paper. I'm gonna try to get this bigger. I'm gonna do it bigger, get it done bigger where I can show it bigger. I'm gonna figure out how I can do that. We'll figure that out, and maybe I'll do another video why it's more larger where you can see it. Okay. So the next position. Oh, and actually they have here for the lateral position, it says side of head, ear, shoulder, hip, greater torch, what is it? Torch hunter, knees, and ankles. So those are all the pressure points on your body. All the pressure points where it's like a bony area. So that's why they use the pillows for those bony areas. So that's why they're giving you these, it says the side of the head, because it got like a, bony area right here, So that's why they, you can get the cubital ulcers in every areas of your body. Your skin can break down so bad. So that's why they use those pillows. And they have prone position, cheek, collarbone, breasts, women, gentle men, you know, for the men, because that break down to knees, toes break down to all of these things break down, so they why that's why they use the pillows, so that way it can protect your skin, the bony areas, for your, so you won't have a skin breakdown. So this is prone position. See, that's prone position. I know this paper is just so bootleg, but I'm gonna get it bigger so that way I can start presenting it bigger for y'all. I'm gonna find a way of getting this picture bigger. Color picture. I can print them out color and it'd be more bigger for y'all, and put them in like clear plastic to protect it. I'm gonna have it all professional, you know. But I'm trying to get these topics out, you know. So just bear with me. It's gonna get better. And you can go back and look again when I do present it bigger, so I can give you a more understanding, and I'll probably have more writing on it where I can read it more bigger. This is like it says here, oxygen the cells receive. Amount of oxygen the cells receive. See, these repositionings is very important. It helps the breathing, you know. So this is the prone position. See, you got the prone position. Well, I don't think I could put that close. The prone position is the pillow under the head, and then at the end by the ankles, so that way, you know. And if you on a back, if they on a back, you still put the pillow there for the prone position, so they won't have the cubital ulcers on their heel. So yeah, and that is the prone position. That's prone position. You know, it's always good to lay on your stomach, and all of these positions helps a lot of things, for your muscles, your joints, your skin, not having a skin breakdown, to get into cubital ulcers on your body. Yeah, and fluids in your body can, you know, move around there. So they are very, very important. People don't realize how important repositioning is. It's very important. So the next position is supine. Supine position is back of head. So that's on the back. So remember, prone position is on the stomach. So lateral position is like to the side, each side, lateral, and prone position is on the stomach. So you guys kind of keep that in mind. You know, lateral is to the side, each side. Prone position is on the stomach, and supine is on the back. That way you can always get all of these positions, 3 positions where you need to really keep in mind, because everybody gonna get old. Okay, so back of head, shoulder blades, elbows, and what is that? I barely see this. Scrotums, spine base, scrotum spine base. See, they have the let me cover that because I'm talking about this one, this position. They got the 2 you can make like a roll. They got 2 pillows on each side of the hand. That helps the bony areas here, when, you know, because people that's bedridden, they in a bed, and, you know, just keep in mind to turn them. so that their skin won't break down, because the cubital ulcers will cause death. So you gotta keep that in mind. It's very important to reposition your client and your patient if they're bedridden. Okay? So that is the supine. Let me fold this right where y'all can see it. I'm up here trying to fold it bootleg. So that's supine. Supine position. That's supine position. And you guys, y'all try these positions for yourself. I know I do. I can give me some. So that was the ending of that. That's repositioning. I am going to keep it there. And then I have some other techniques here that y'all maybe want to see. This is called a gate belt. And, you know, that is, let me move that up. That looks so tacky. Let me throw that under. That's like that's a gait belt to help lift them up. If, you know, they can't stand, they can't ambulate, they can't walk. And then that's when you can use the gait belt, put them on a toilet, put them on a shower chair. You know, this is all activity daily living. Ugh. It's just all about ADL, activity daily living, where you're gonna bathe, you bathe, everyone have to bathe. So yeah, that's what it is. And I guess I just thought I'd show you guys that picture. I'm gonna get all of these pictures blowed up, and then I'm gonna have it all set up where, you know, I can really do it right for you all. And then they have, you know, this is the grooming part. That's the grooming part, you know, when you bathe, because, you know, soaking in the bath, it kind of relax the muscles. It helps with pain. So if they in the bed, you know, if you're able to do it, you know, if they soak in some warm water, not too hot, but it relaxes the muscles. It helps for pain. So this is the lady grooming the, you know, she just showered her. This is how they do it. Put them in a chair, dry them off, and put their clothes on, and then get them gone. And this here little part here, this is like a CPR. I'm gonna do that on another video for the CPR, the steps of the CPR, because I have to have that all written out and nice for you guys. But I wanted to show you guys this picture too. You know, like if someone is vomiting or they're having some type of problem with aspiration, you know, always put them on their side so it can come out on the cheek. It will lay to the cheek, and then it'll come out eventually. See, you know, and I guess you really don't, when someone is having a seizure, you don't lay them flat like that. See that? You don't lay them on flat. They have to have something to elevate their head so that they won't swallow their tongue. So that's a good point for like people that have seizures. They're mostly bedridden. So I guess that's all the topics for today. Thank you for joining me with Rachel the nurse. So until I figure out the next topic, you guys see me back again. So that was the topic of repositioning. And I did do a video on a job that I took, and it seems like it's going okay. The person is used to me. We working it out and getting to know each other. You always have to get to know your client or your patient and get a connection, a relationship, so that way it'll work out very smooth. So it is working out, and I thought I would do this video since I'm here with my other client. And I have to, because I'm gonna be busy. When I'm going to my other person, I'm very busy. So it's like kind of hard to get videos in, but once I get myself balanced, I will be shooting through here. So thank you guys for joining Rachel the Nurse. And that was the topic of repositioning. Keep that in mind. Even practice it on your own self, your babies. You know, it's good for your babies too. Because you know, when people get older, they become a baby again. So keep that in mind too. I always try to have patience, a little patience. Everybody have their own life, like to get out, have a clear mind and have fun, but just keep things in mind and then you can shoot and have your fun. So thank you for joining again. Make sure you hit that like button, hit that notification bell button so that way you always know when I have a video uploaded. Until we meet again, God bless you.